Hello, my name is Angela. I will be your nursing student for the day. So today I'm going to be showing you how to use an incentive spirometer. So an incentive spirometer is used to help with deep breathing. So I have one right here. So this is what it looks like. So first what you're going to do is you want to sit up in bed or in a chair. And you're going to hold this device, and so here's the mouthpiece. So first you're going to put the mouthpiece in your mouth and don't block it with your tongue. And so first you're going to exhale, breathe out first, and then you're going to put this in your mouth and you're going to take a deep breath in and make it as deep and as slow as possible. And when you do that, you want to keep this little ball right in the middle of the smiley face or the desired area. And so when you breathe in, this is going to raise, and this right here is the indicator. So we're going to use this indicator as a goal to work towards each deep breath when you use this. So this will already be set. So you're going to put this in your mouth. After exhaling, you're going to inhale, and like I said, you're going to keep this with the little ball within the proper range. So take a slow deep breath as long as you can, and then when you can't breathe in anymore, you're going to remove the device from your mouth and you're going to hold your breath for 3 to 5 seconds. After you do that, you're going to exhale, and then you're going to cough a couple of times. So if you end up getting lightheaded or dizzy, what you want to do is you're going to slow down your breaths and you're going to allow for more time in between each time you use this device. So you want to be using this about 10 times an hour. So I suggest if you're in the hospital or you're in bed and you're just watching TV, probably try to do this each time a commercial comes on. Next, I'm going to be teaching you how to deep breathe and cough. So first things you want to do is you want to sit up to a Fowler's or semi-Fowler's position. And you can lean against a pillow and relax your shoulders. So if you have a chest incision, you want to do this with a pillow on your chest. But for diaphragmatic breathing, you're just going to use your hands. So you're going to place your hands along the lower rib cage and have your middle fingers touch. Next, you're going to take a slow deep breath in. You're going to hold it for about 2 to 5 seconds, and then you're going to exhale throughout your mouth. So when you breathe in through your nose, hold it 2 to 3 seconds, and breathe out with your mouth. And while you're doing that, you're going to notice your chest is expanding, and it expands as your diaphragm is lowering. So after you do about 3 to 4 cycles of that, you're going to want to cough. You're going to want to cough rapidly in order to get secretions out. If you are too weak to cough, then you want to do, it's called huffing. Like after exhaling, you want to huff like 3 or 4 times with an open glottis, because that way it'll still loosen up secretions, but you're not using all of your muscles to cough. Now I'm going to be teaching you how to do leg exercises. So we're going to start with the ankles, and we're going to do ankle circles. But first, before any leg exercise, you want to be laying supine in a bed. Okay, so for ankle circles, you're going to pretend this is your foot. Okay, you're going to have your foot dorsiflexed, so up, pointing up. And first you're going to rotate it, or I'm going to rotate it for you clockwise. So 1, 2, 3. You're going to go counterclockwise, 1, 2, 3. And so you're going to do at least 3 exercises, both rotations of your ankles, and then you're going to do the other ankle and repeat 1, 2, 3, 1, 2, 3. And remember, your foot is dorsiflexed, so it is flexed upwards. Next exercise is called ankle pumps. So for ankle pumps, once again, you want to have your feet or your ankles dorsiflexed. And for this exercise, you're going to push your feet forward so that it's actually called plantar flex, so it's forward. And then I'm going to pull it up for you. So it's going to go up, dorsiflex. And as I'm doing that, you want to keep your legs straight on the bed, and you want to push the back of your knee down on the bed as I'm pulling it. And when you do that, you're going to feel a pull in your calves, which is what you want. So you're going to do that several times, pushing dorsiflex, planiflex. And after doing that several times, you're going to switch and do the other ankle. Last is just normal leg exercises. So for this one, so you're still laying flat on the bed. Pretend these are your legs. You're going to, and your feet are just normal. You're going to pull your foot up. So pretend this is your knee. Your knee is flexed, pointing up at the ceiling, so that your foot is flat on the bed. And then you're gonna slowly put your foot forward, keep going until your leg is fully flat on the bed. And once again, pull your foot up so that your knee is pointing up towards the ceiling, and then push it back down. So once again, do that several times, and then alternate legs. So you're gonna do the same exact thing on the other leg. So last, I will be talking about the rationale for early ambulation in post-op patients. So ambulating after a surgery is actually very important because, well, for a lot of reasons. One being that it helps with blood flow of oxygen throughout the body. Another thing is the blood flow helps if you have any wounds. Wounds will heal faster if the blood is flowing throughout the body. A really big one is that it will help prevent blood clots from forming, which can cause strokes. It can cause major problems that we want to avoid. Ambulating will also help improve your strength, physical strength, and also breathing with your lungs. The whole pulmonary system can benefit from being up, being active, as well as your mood. And for those who have a hard time eating post-op, it will help stimulate your appetite. So it's really important to ambulate because it will keep you healthy and it will put you on the road to recovery.